So again, you're all very welcome to this virtual ribbon cutting of the Oral Health in Adults with Cystic Fibrosis website. My name's Nicola. I do communications for CFI, and I've been tasked with introducing you all and welcoming you here. So it's very exciting. It's a really great example of the importance of partnerships between research teams, clinicians, and patient advocates, and how research can be translated into tangible, impactful resources which improve the daily lives of those living with CF. CFI would like to acknowledge and thank the incredible work of the research team, the funders, patient advocates, and all those who have contributed to the website launch today. So without further ado, I'm going to pass you over to Martina, and she'll take us forward. Thank you.
Thank you very much, Nicola. So welcome everyone to the launch of our website, which is www.oralhealthcf.ie. I'm Professor Martina Hayes. I'm a dentist and a researcher at University College Cork. When I first contacted Cystic Fibrosis Ireland, it was back in spring 2019, and I was keen to speak with some patient advocates about oral health and how they felt about accessing oral health care. CFI immediately responded, saying that they had already identified oral health as an under-researched area and a priority for their membership. So some seed funding from Cystic Fibrosis Ireland and from UCC College of Medicine and Health CISA Awards led to a substantial grant from the Health Research Board. This allowed Drs. Niamh Coffey and Dr. Fiona O'Leary, along with the staff of the CF unit in Cork University Hospital, to conduct the largest clinical study into the oral health of adults with cystic fibrosis worldwide. I'd like to take this opportunity to thank the more than 100 people with cystic fibrosis who agreed to participate in our research at the height of the COVID pandemic. We've published 16 scientific papers on our findings and won multiple research awards, but we were really keen to get the information to the people for whom it matters, the cystic fibrosis community. Further funding from the Health Research Board in 2022 allowed us to work with Cystic Fibrosis Ireland patient advocates to build this website with all of the information that we felt would be most helpful to people with cystic fibrosis, parents and carers of children with cystic fibrosis, and also for oral health care providers who might not be very familiar with the condition. So I'll hand over now to my colleagues to give you a quick look at the website, and we'll start with Dr. Fiona O'Leary.
Thanks, Martina. So I hope everyone can see my screen here. So as Martina said, my name is Dr. Fiona O'Leary, and I was one of the researchers on this study. So along with my colleague, Dr. Niamh Coffey, I'm going to take you through a live tour of the website. So this website serves as an invaluable resource for people with cystic fibrosis, their families. It offers comprehensive and easy to understand information, so to ensure that oral health can be maintained and optimized. And the resources that I'm going to show you specifically are specifically for people with CF and for parents of children with CF. And these tabs contain information that covers a range of important topics tailored to the unique needs of these individuals. So the first tab I'm going to take you through is for people with CF, particularly adults. And this resource opens with information on visiting the dentist or attending your dental practice. And this section offers guidance on how to approach dental visits confidently with peace of mind, helping people with CF navigate dental care with less anxiety and greater awareness, particularly in this post-COVID era. We've also included a policy further down on the page. It's our helpful guidelines for dental practices to implement when making appointments for people with CF. And there are simple steps within this policy that can be taken to minimize risks specific to people with CF. We've also included information relating to managing one's oral health and with conditions such as gastroesophageal reflux disease, or the impact that medications such as inhaled steroids and bisphosphonates can have on oral health. It outlines how to minimize these risks, and it outlines the important steps that people can implement at home when using inhaled medications, or the importance of seeking a dental checkup before starting on bone-targeted therapies like bisphosphonates, and seeking dental health checks during or while on treatment. There's further information included within this section on it's related to solid organ transplants and oral care, so that people can understand the critical link between maintaining good oral health and the impact that this can have on the success of solid organ transplants. And it highlights the need to maintain good oral health before and after transplantation, and the reasons why it's important. We've included information regarding dental care financial entitlements in Ireland, which I think, given the current cost of living, is quite apt, and it outlines the financial support available for dental care and make it easier again for individuals to access the services they need. The second tab I'm going to take you through is for parents or for carers of children with cystic fibrosis. And again, this dedicated resource provides helpful information on managing children's dental health, with a particular focus on enamel defects and on dental decay. So within the study, we found that people with CF have more enamel defects, and while these defects do not directly cause disease, they certainly place individuals at a higher risk of developing dental decay, dental erosion, or people may experience increased sensitivity. So within this, we provide information so that parents can learn about the increased prevalence of defects, what these defects present as, what they might look at, and the risks they pose to oral health, as well as practical ways to minimize dental disease from starting in these teeth. We've also included information related to dental decay, and since diet plays such a crucial role in the management of CF, this section offers insight on how diet influences dental decay, and again, what to watch for, the signs and symptoms of decay, and effective prevention methods for parents. So again, both these two tabs offer comprehensive, easy to understand information and real-life applicable information, which I think is important, so that people with CF and parents of children with CF can maintain optimal health. So at this point, I'm going to hand you over to my colleague, Dr. Niamh Coffey, so she can continue on the tour of the website.
Thank you very much. I'm just going to try to share screen there. Perfect. So thanks very much for that, Fiona. So as Fiona mentioned there is a lot of information on the website for people with cystic fibrosis and parents or guardians of children with cystic fibrosis. But something that we also wanted this website to be was to be a resource for dental professionals who are dealing in the care of people with cystic fibrosis. So to that end, we have a tab here specifically aimed at dental professionals. So it essentially gathers all of the information that we found out throughout the course of the research project, and have put it here in kind of an easy to understand fashion for dentists, hygienists, dental nurses who are dealing in the care of people with CF. One of the points raised by some of the participants was that they would love to have a resource that they could actually signpost their dentist to, just so that they could get a little bit of further information about what CF is and how it can be best be managed in the dental setting. So we have sort of laid out briefly for dentists who may not have a lot of experience in dealing with people with cystic fibrosis, some of the unique challenges that can be faced by people with CF, where the most significant effects are seen, and what type of medications people with CF are commonly on, and essentially kind of zoning in on the oral health implications of those, just so that they might know if someone comes in for an examination and they have CF, you know, just to have a little bit more information around this, and know what we're looking out for. As Fiona touched on, if people are taking bisphosphonates, that's something that we would really like to kind of flag and zone in on, as well as that oral nutritional supplements. That's not something that we as dentists routinely ask about during our medical history taking. So it's just for dentists to be aware that these are some of the unique challenges faced, and to essentially optimize the dental care of these individuals. We give treatment recommendations for dentists in order to provide better and more comfortable dental care for people with CF. So again, one of our questions that we asked throughout the course of our project was, what would you like dentists to know? What would make your dental treatment more comfortable? And what we wanted to do with the results of our research project was to get that information back out to the dentists who are dealing with people with CF. So one of the simple things that was mentioned a huge amount was not lying the chair fully back. Dentists might not have been aware of that, and some people with CF might not feel comfortable maybe saying that at the appointment. So we put that information here so that dentists are able to educate themselves on how best to manage and to care for and optimize the oral health of people with CF. So that basically has links out also to the Cork Centre for CF and to CF Ireland as well. But this is more for sort of clinical dentists. So the final tab, just to talk you through, is the scientific community tab. And we basically have this section here to lay out the science, the research behind everything that we are promoting on this site. The idea of this is that other scientists or researchers can investigate what we've done, can look at the research that we've carried out, and maybe see some areas that they might want to develop on or to link in with us about, to carry out further research, and again to achieve the end goal of improving oral health in people with cystic fibrosis. So there's a link to all of the articles, all the publications that we made, some posters that we presented throughout the course of the research project. They're all freely available there, and we will be updating those as more articles are generated. So that essentially is kind of a whistle-stop tour of the entire website. So what I would like to do now is to hand over to our CF patient advocate, Caroline Heffernan, who was extremely helpful throughout the course of the project for the ribbon cutting. Thank you.
Good afternoon, everyone. It's a privilege for me to actually be cutting the ribbon, but before I do, if it wouldn't be like me to actually say a few thank yous. So I just wanted to say, from being involved from the beginning, myself and Nori and all the other people that inputted into the research, how absolutely fabulous it is that from research to have this fantastic resource that not only people with CF but dentists and all medical professions can actually look at. I remember my first conversation a long time ago in Cork, and it's just amazing to see how far it's come, and I appreciate it was through difficult times during COVID. So for me, thank you so much. On behalf of my community, thank you so much for bringing research into real lives for us and making it understandable for those that may not have known the ins and outs of CF. So with that, I hope the ribbon works well for me. So here we go. The site is officially launched. Well done, everyone that's been involved. It's fantastic.
Thank you so much for that, Caroline. I'd like to thank again, just to round out, thank our funders, Cystic Fibrosis Ireland, who gives the seed funding to get started, UCC College of Medicine and Health CISA Awards, and then really our main funders were the Health Research Board. I'd like to thank the design team at Juvo Web Design. We're dentists and researchers, we know nothing about web design. My sincere thanks to Niamh and Fiona for their work conducting the study, to the staff and the attendees of the Cystic Fibrosis Unit in Cork University Hospital, and in particular the dedicated and really enthusiastic research nurses. To the wonderful team at Cystic Fibrosis Ireland, and in particular Rory Tallon and Caroline Heffernan, who helped us from the very first day of this research and through to this website. And as Caroline said, it's so important to bring the most important perspective to this work, and that is the perspective of people with cystic fibrosis. I hope you will all visit oralhealthcf.ie, use this resource, share this resource. This is a live website and we're so happy to add to it or change content. If there's questions you feel we haven't addressed, if you go to the top right-hand side, there's a link to our Twitter page or our X page. And you can contact us through that social media, and absolutely we'd be happy to engage with anybody. We're also more than happy to talk to any interested groups about the importance of oral health for people with cystic fibrosis, and in any forums where we can highlight our research. So thank you so much for joining us and helping us to spread the word. Thank you.